Welcome back. You're watching Channel 1 News, and this afternoon, this is going to be the most interactive part of this bulletin. We're going to discuss health matters and also medical tourism. Did you know more than 10,000 people travel out of the country to seek medication, and in this, they spend more than 10 billion shillings. What attributes to this? And where are we heading to as the country? In this discussion, I'm engaging Colombia Africa Clinical Coordinator, Dr. Linda Thorpe, to discuss other matters, health, tourism, and medical concerns. Now, to kick us off, why do we have non-communicable diseases accounting to over half of the occupation in our hospitals in the country?
Well, the majority of people who are having non-communicable diseases are people that probably have not been screened in the past. So this accounts for a lot, because the screening should actually take place a lot earlier than it is taking place. Things like high blood pressure, diabetes, kidney disease, all things which cause admissions into hospital, things like stroke and cardiovascular disease like heart attacks, all those things are potentially preventable. Obviously, as a population, luckily we're all living a lot older than we used to live, so these things now account for more problems as we get older. There's also things like cancer, which there are very good screening programs, such as for breast cancer, for cervical cancer, and also actually now for colon cancer. So if these were addressed at earlier times and at the right time, then we would probably see that this number of issues with communicable diseases and admissions would drop. We know that across the world, actually, non-communicable diseases, such as the ischemic heart diseases and strokes, are increasing, whereas the communicable diseases, such as all the infectious diseases, is actually decreasing. So I think we also now have to turn our attention onto these lifestyle preventing diseases.
And I understand you picked Kenya as the first country in Africa, as much as Colombia is in other parts of the world. Why did you settle on Kenya? And in this country, we have seen rising cases of people with cancer and diabetes traveling out of the country. For the period that you've been in the country, having come up with two facilities, one in Parklands and the other one in Lavington, why the rising cases of people traveling out of the country?
Okay, well, it's interesting. Yes, we have chosen Kenya as the first port of call, if you like, in Africa. As we know, it's very centrally placed. It's headquarters for a lot of international companies as well. People actually come into Kenya from abroad in the African region to seek more tertiary care. We have some good tertiary care hospitals here. So Kenya actually is an attraction for medical care, as well as people leaving Kenya for medical care. The interesting point here is that people who go and seek medical care abroad, sometimes they don't actually need to. It's just that other things prevent them from staying in Kenya. One is cost. So obviously healthcare has to be affordable for people to stay here, and abroad this healthcare can actually be more cost effective. The other thing is sometimes people would rather go abroad because they've seen better results from maybe other patients or friends and are told that they shouldn't stay here, they should leave. The medical facilities in Kenya is improving all the time, and actually we have some world-class facilities. So in regards to facilitation expertise, Kenya is actually vastly improving and should actually be somewhere where, you know, patients should think about and consider staying. We, as I said, we also have a lot of expertise here, and sometimes, to be honest, the expertise may not be as as important or experienced, I should say, as some places abroad where perhaps they do a lot more of that particular procedure. Sometimes we do miss the infrastructure as well. So it really depends on what it is, but I think the good take-home message would be that, you know, Nairobi and Kenya's healthcare standard is very, very good and improving all the time.
From the way you have just mentioned, we also receive other patients from other countries, what could be the percentage, if there is any, that travel from other countries to seek medication to Kenya, according to your analysis report?
Okay, well, I'm sorry that I can't give you an exact percentage, except that there is a lot of people that do see Kenya as a hub, especially for the international companies that are around. They may come and fly into Nairobi first to seek treatment, and if that is not appropriate, then they may fly into Nairobi and then fly out. It all depends, really. But as I said, we've got a great medical facilities in Nairobi, and we've got the expertise here most of the time. Sometimes we don't, and that's when patients may travel out if there is no choice.
And apart from these other diseases, cancer, diabetes, and other non-communicable diseases, there is great concern, health experts urging us to take part in healthy living and also ensure that we go for these wellness programs. What is your take in regards to this? Is it a necessity?
Well, basically, lifestyle is the fundamentals of all disease processes. So if you are overweight, or you take too much sugar, or you don't exercise, then this will obviously lead you to potentially have issues like the cardiovascular disease, ischemic heart disease, that's the same thing, and also cerebral vascular disease and diabetes. So that is very fundamental. Now, in order to make lifestyle changes, you have to know that these are going on in your body, and the best way to know that is to personalize your own healthcare and to go for healthcare checks. And these involve things like checking your blood pressure, because this is what we call the silent killer. So you won't know your blood pressure is actually raised until you actually have a check, because it does not have any symptoms. Things like diabetes, if caught early, it's much more likely to be a successful outcome, because the longer you have untreated diabetes, the worse your outcomes are in the future. All these issues, if you take care of them early, are something that shouldn't have a great impact on your longevity in life. And as we know, we're living longer these days. The other things, such as screening for cancers, is really important, especially in women, for cervical cancer and for breast cancers. These things done early obviously lead to a better outcome. Cervical cancer is totally curable, and so is breast cancer if they are caught early. The issues come when they're caught very late. Things like kidney disease, which again you may not pick up, but can be picked up at very early stages with urine tests and also blood tests, can be treated and then issues prevented in the long run.
As we come to the close, what is your take when it comes to capacity in Kenya, now that you've said that those people who travel to Kenya to seek medication? Do we have capacity to handle these? These, as you also make your closing remarks.
Well, capacity is always growing in countries like Kenya, and we are seeing a return of some of the specialists that have actually left to go and train abroad and come back. I'm sure on the horizon there will be new hospitals which will increase the capacity. Obviously, the hospitals here rely on the clientele from here mainly, and it's only a few specialised cases that will come in for secondary care. We do see international patients coming in for the health checks, which come to Colombia, Africa. And this is mainly because it's a trusted centre, and the cost of the health checks is very affordable. So people should go and get their health checks done, and they might be surprised at how cheap and affordable the health checks are across the board. Obviously, health checks are designed for specific age groups as well. So, you know, you may not need such an expensive health check at 30 as you would do, for instance, at 50, when more things are tested, because that's more when you become at risk.
Thank you, Dr. Linda. We would love to engage you more, but time is not on our side. We would like to invite you once again. That is Dr. Linda Thorpe, discussing to us medical matters here in the country and also across the globe. He is the Colombia Africa Clinical Coordinator.